This video is solely for the purpose of a college health assessment course.
May I come in?
Yeah.
Okay, I'm here. I'm going to go ahead and shut this door for privacy and wash my hands. My name is Chelsea and I'll be your student nurse today.
Okay.
Let's go ahead and check your wristband. Can you state your name and birthday, please?
Shannon Brennan, and my birthday is June 14th, 1991.
Perfect. Okay, Shannon, so what brings you in today?
I'm just getting my wellness exam, my annual wellness.
Good. Alright, can you just give me a few words for your present health status?
I would say that I'm healthy, and I eat well, and no major problems with it, really.
Great. Have you noticed any changes that you would like to discuss today?
No, doing pretty well.
Great. Do you have any current medical conditions or chronic illnesses?
No, I have chronic mono, but that really hasn't come up since like middle school, high school.
Okay, great. Let's see. Are you on any current medications?
Just Claritin and for like seasonal allergies, and
It's that time of year.
yeah, it is. And I take melatonin before I go to bed sometimes.
Okay. All right. So you mentioned seasonal allergies. Do you have any allergies to medications?
Yeah, I'm allergic to penicillin.
Okay. What about foods or other medical products?
No.
All right. Great. Are you under any current medical treatments?
No.
Okay. Great. We're going to go ahead and go back to your past health history, if that's okay with you.
Mm-hmm.
Perfect. So, were you ever exposed to measles, mumps, or rubella?
I got the vaccine.
Great. What about chicken pox?
Mm-hmm. I had it when I was 5.
5 years old. Okay. How about any influenza experiences?
I had it like twice in college. I got the vaccines, but I just lived in a dorm, and
Yeah, it spreads quickly there.
mm-hmm.
All right. What about ear infections or throat infections when you were young?
No, I was more of a stomach flu type of person.
Lucky you.
Mm-hmm. My mom was the lucky one.
Oh. How about any previous hospitalizations or surgeries?
I had a lymph node removed from my right underarm in 6th grade, so 2001.
Okay, 2001. All right, great. Moving forward, we're just going to talk about your immunizations to make sure they're up to date.
Mm-hmm.
Have you gotten your tetanus recently?
Mm-hmm. I think I'm due next year.
Okay,
around
great.
May.
And you already mentioned measles, mumps, rubella. How about your HPV
Mm-hmm.
vaccinations? Great. That's good. All right. When was your last physical examination?
Probably around June last year. That's when my birthday is.
All right. And your last menstrual period?
Last week.
Okay. Have you had any pregnancies?
Mm-mm.
Okay. And what about your last pap smear?
I think it was in November last year.
Great. That's good. So we're going to go ahead and talk about your family history a little bit. Are your parents, how are they with any chronic illnesses or diseases?
My mom's really healthy. My dad has psoriatic arthritis. He's a pretty good handle on that. And yeah, my mom has like a little bit of high cholesterol, but she doesn't have high blood pressure, and she's really healthy. So it's kind of just a genetic thing.
Yeah, good to know. Your mother's side. So your mother's parents, did they have any health issues?
My grandmother is alive and well. She has like sciatic nerve problems.
Okay.
It's about the only thing. And then my grandfather died 2 summers ago, and he died of Alzheimer's. He had some earlier like strokes and blood clots, but after those he was really healthy for like 30 years until he had the Alzheimer's set in.
Okay. Does your mom have any siblings?
3 sisters.
Do they have any health conditions?
Just rheumatoid arthritis in one of them, and then another one has had breast cancer, but she got radiation and beat it.
Great.
Really early.
Good. And your father's parents?
Both of them are deceased. My dad's dad died of a heart attack in 91, and then my dad's mom died when I was 8, so that would have been 99, and she died of cancer of the soft tissues.
Okay. And then does he have any siblings?
He had a brother just pass away from a lot of like cardiovascular issues, but he ended up getting an infection and just went really fast.
Right.
Oh, and then another one of his brothers died of AIDS, like in the early 90s too.
Right. That's significant. Okay. Alright, so we're going to talk a little bit about personal and psychosocial history. So can you explain your living situation?
I live with 2 other girls, and it's going really good. We have 3 dogs, and they're all getting along really great. So
That's good. How about your diet and nutrition? Have you noticed any changes with your diet or weight loss or weight gain?
sometimes when I'm busy, it's hard to eat healthy, but I try and like only buy healthy foods. So I'm still a vegetarian and have been for about 4 years. And as far as like exercising goes, I try and get out and do stuff, but like I said, I'm kind of busy, so it's hard to fit it in.
Yeah, that's great. All right, what about any tobacco use?
No, I don't smoke.
Good. How about alcohol use?
I'll have a glass of wine like maybe once or twice a week, but mostly it's just on the weekends.
Okay.
Pretty much
And
just
how many
socially.
drinks would you estimate that as?
Probably like 4 to 5 a week.
Okay. How about any illicit drug use?
No.
Great. Do you do any self-examinations?
Yeah, I do my
Specifically
monthly
for your
breast
breasts?
tests.
Great. All right. Can you go ahead and describe your, you already described your living. How about work or school?
Yeah, I used to work at a restaurant, and that was pretty awful. I hated it. But now that I'm done, that was really great. School is stressful as well, but I enjoy it, so
Good.
it kind of balances out. But sometimes I have pretty bad anxiety.
How do you cope with your anxiety?
Mostly just with my dog. Calms me down to just sit with him and kind of like take a breather.
Great. All right, so we're going to go ahead into your physical exam, if that's all right.
Yeah, definitely.
Okay, we're going to start with your hands.
Mhm.
All right, so first we're just going to check for any lesions or abnormalities. Your skin looks really good. You do have a nice tan. Do you use sunscreen?
Sometimes at the beginning of the summer I do.
Yeah.
I usually forget by the end.
Just keep it in mind. It's a good practice. We're going to check palmar creases, skin turgor. It's instantaneous. Capillary refill. Great. Radial pulse for 15 seconds. Good. Brachial pulse for 15 seconds. So that's nice and strong. Out of 2. We're going to do it bilaterally, checking your palm, skin turgor. Good. Capillary refill. For this one, I want you to go ahead and place your hand on your chest. We're going to assess respiration and radial pulse at the same time. So I'll be watching your chest for 15 seconds and taking your pulse for 15 seconds. Okay, great. Brachial pulse. Very nice. We're also looking for any moles. You don't really have any, but if you were to develop one, you just want to make sure that it follows the ABCs. So you want it area and border, so you want them nice and they stay the same. Color, color, and then diameter and elevation. So you want to make sure the color is not too dark, the diameter is no thicker than an eraser head,
Mm-hmm.
and then it's not elevated when you just brush over your skin.
Mm-hmm.
So your skin is warm and dry. Very good. So we're going to go ahead and check your neck and head. We're going to check your carotid. Nice. That's 2 for 15 seconds. On this side, 15 seconds. Check your hair. It's not brittle. And your scalp for any visible infestations or lesions. Nice. Very healthy.
Great.
And go ahead and open up and say ah. Ah. Great. Your tongue is pink. Your mouth is moist. Looks good.
Awesome.
So now we're going to listen to your lung sounds. You want the earpieces facing forward.
Mhm.
Every time I place the stethoscope on your chest, go ahead and inhale through your nose.
Mhm.
Exhale through your mouth.
Okay.
Okay. We're going to start at the top, above your collarbone. Good. And there are 8 on the front. Good. Over here, we're listening for vestibular sounds. Good. We're going to listen for bronchial vestibular sounds here. Good. And then bronchial sounds here. Great. While we're here, we're also going to check the alignment of the trachea.
Mhm.
And it looks great.
Great.
Okay. We're also going to check your heart sounds while I'm in the front.
Okay.
Okay. We're going to listen to your heart sounds. We'll start at the angle of Louis, over and down to the second intercostal space. Good. And we're going to listen to your aortic valve for a minute. Going over to your left side, second intercostal space. Listen to the pulmonic valve. Good. And down, fourth intercostal space on the left. Listen to the tricuspid for a minute. Good. And then down to the fifth intercostal space, mid-clavicle. Good. This is the mitral, and we'll listen for another minute. All right, so while we're here, we're also going to get the apical pulse. Apical.
Okay.
Listen to that for a minute. Okay. So we're going to listen to the lung sounds on your sides. Perfect. There are 4 on the right and 3 on the left, so go ahead and inhale. Good. Great. And usually in a normal exam, we would be doing it under the shirt, not over. Good. All right. And then we're going to go to the back. And there are 10 on the back. All right. Inhale. Awesome. So what we're listening for is any crackles or wheezing, and yours sound great. We're going to check your chest expansion. So go ahead and inhale nice and deep for me. Good. And that was great. So when I had my hands on either side of your spine, you inhaled, my hands separated, and came back together when you exhaled.
Cool.
Now we're going to check your chest circumference. So it should be a ratio of 2 to 1, and it is. That's great. We're going to check your capillary refill on your legs. Awesome. And then come on down to your feet. We're going to check your dorsalis pedis pulse for 15 seconds. Good. And then your posterior tibial for 15 seconds. Good. And then capillary refill on your toes. All right. And then we'll do that bilaterally. 15 seconds. 15 seconds. And then capillary refill. All right. You're healthy as a horse.
Thanks so much. That was great.
You're welcome. Have a good day.
You too.